Hello, Diaz here, founder owner Greenwood Dental. Today I'm talking about the reasons why sometimes we have to refer you guys to a specialist, a dentist, but they are specialized in certain procedures that we don't offer or we don't have the training to do. One of the things that we are constantly dealing with is the pushback for you guys to be referred or the pushback for you guys to go somewhere else. And it's not like we're trying to send you somewhere else because we don't want to see you. It is very, very overwhelming and very flattering that you guys want to stay with us all the time for every single procedure. And we wish that we can offer every single procedure in the book in order for you guys not to go somewhere else. And we're working on it. For example, all our dentists are qualified or certified for Invisalign, so we're Invisalign providers. 2 out of the 3 dentists in our brand do place implants. We do, to a certain point, root canals, we do all crowns, we do dentures, we do the extractions of pulling the teeth. But there's certain conditions, unfortunately, whether we don't have the tools or the technique for it, or we don't have the expertise or the training to do a certain procedure in order to guarantee great results or amazing results or to avoid any failure. So the referrals are meant to be to dentists that have that kind of experience and they've been trained and they see those certain conditions over and over again. And they're experts in these conditions. Just like when you guys get referred or we get referred to a GS specialist or a gland specialist or endocrinologist or ENT or lung specialist or asthma specialist. It's exactly the same thing. These professionals been to school for extra schooling too in order to deal with certain conditions that we don't see every single day. So the referrals are, we refer to pediatric dentist, and typically we refer to pediatric dentist, which is child specialist dentist, is when the child is too young to be sitting through a certain procedures. And unfortunately, these conditions are catching up with the integrity of the teeth, and they need the extra expertise and extra experience in order to manage their emotions and manage their condition in order to get treated and make sure that we have optimal results. The other one we refer to is oral surgeons. Oral surgeons are, again, they have extensive training for certain procedures like wisdom teeth extractions, or when you hear impacted molars, or if you hear that a molar is far gone or a tooth is far gone, it's broken down, or root tips, they are embedded or buried under the gums, we need a grafting, or you need flapping, more like a surgical extension of the just pulling the tooth. So that's the oral surgeon. Also placing implants in areas that we don't feel comfortable placing or we don't have enough knowledge to place the implant in a certain site. The third one is send to a root canal specialist. I know all dentists are trained to do root canals, but there are certain root canals are manageable and certain root canals, sometimes we don't see what we're supposed to see as far as the condition is concerned. And that's why we send them to a root canal specialist, because they have the tools and they have the means in order to get into the tooth and do the treatment and guarantee great results. The other specialist we send to is a gum specialist. A gum specialist is basically a specialist that can actually do gum surgery, or they can do a certain treatment in the pockets or for the gums that we are not, again, trained for or we are not expertise on. Now, when you train for for certain procedures right out of dental school, then you can just jump in the beginning of your career and start doing those procedures. But also, when you are practicing for X amount of time, you are almost grandfathered into certain procedures because you see a lot of those incidences or you see a lot of those conditions. And with time, you learn how to manage those conditions. And some of us will get extra certification in order to do those, challenging procedures But it's not because we want you guys to go somewhere else. It's just because we are saying that we are humble enough to send you to a specialist, because we are just telling you that we are not good enough for that condition to be treated and give you the best result that you can get. But I hope that, doesn't offend anybody, and it's not like we don't want to see you anymore. By all means, you go see the specialist you refer to, and you're more than welcome to come back and maintain your dental health with us. So it's just a matter of you getting the optimal care and the best experience that you can get without us stumbling on the unknown or the not sure whether the treatment is going to be optimized in our practice. I hope that makes sense. I'm trying to break it down and give you the reason why, but I don't want it to make it too technical. I'm just saying that trust us, that if we say that you need to go somewhere else, it's for a very, very good reason. It's not because we're not qualified. It's just because you need that extra care and you need that extra expertise. And sometimes we refer you guys to get a consultation, because we do learn from these specialists too, how to do certain things. And I had many specialists call me and saying that, you could have done this. But because I did not see those conditions enough, or I did not do this condition enough, I just felt more comfortable and more confident for you guys to see the specialist. I hope that helps, and I hope that did not confuse you even more. Thank you, Dr. Slava. But I just want to clarify that, because I don't want anybody to feel that you're not welcome, or you're not included, or you're not important enough, like I said, for us to spend the extra time. And the longer you practice, or the longer we practice, the faster we can recognize a certain condition and say, okay, that's when we draw the line, that's where the limit is, and you're better off be serviced with a specialist. So that's it for today. We love you. Be safe, and DS out.